Good evening, everyone. My name's Noam. I'm a clinical psychologist and co-founder of Wellifiy. So several years ago, I was working in a hospital and we had this really big problem. After we would discharge people, they would often come back to the hospital or worse. In parallel, I was also working in private practice. And although we know from a mountain of research that people really need 10 to 20 sessions to get that long-term benefit out of therapy, we also know from Medicare data that most people drop out after about 3. Now, as I was looking closer at these problems, my wife and I had actually just bought our first air fryer. And let me tell you, this thing was incredible, right? It came with recipes, it came with information about how to clean it, and information about how to take care of it. And then this odd reality struck me. This $120 air fryer came with better information and guidance than we were giving to our patients at the end of a $20,000 hospital admission, right? The sum total of which would typically be a business card with a phone number on the back of it. And that is a huge problem because mental ill health and hospital readmissions cost Australia $42 billion a year. So at Wellifiy, we're solving that problem. We've developed an incredibly dynamic patient-facing mobile app and interconnected clinician-facing portal. They work in tandem to provide patients with round-the-clock access to tools, resources, and peer-reviewed content that their care team has curated specifically for them, and provide clinicians with the insights that they need to deliver truly personalised and optimised healthcare. We built it to be extremely modular and customisable so it can meet the needs of different organisations and different patients. And we also white label it, as you can see with some of my beautiful little babies, I call them. Our team is led by myself and my co-founder, Paul Collier, who is our CTO. He has over 20 years of experience building tremendous startups like Redbubble and Sleeping Duck, and we're supported by a growing team of engineers and content creators. So where are we at? Well, right now, hospitals, community mental health, drug and alcohol services, and private clinics around Australia are using Wellifiy to improve patient outcomes, help patients self-manage, and improve patient literacy. We've helped some of our customers win over $25 million in funding over the last 12 months, and we're now being approached by departments outside of mental health specifically, from maternity to chronic pain to oncology, to transpose Wellifiy into their settings. We've also got approaches now internationally from Israel, America, and India. And actually, earlier this week, we signed our first international deal with Canada, which is very exciting. So tonight, our ask is not for funding. We're going to open up around early next year. So if you are an investor and you're interested in what we're doing, we'd certainly love to connect and start to build some relationships. Tonight, however, our ask is really to connect with healthcare leaders and execs. I think Mark from Pindara is in the room and Sandeep from Gold Coast. I'd love to chat with you and other execs that are interested in innovating mental health care delivery. Essentially, if you're a healthcare leader and you want to ensure that your patients have round-the-clock access to all the tools, resources, and content that they deserve, and that your clinicians have access to all the insights that they really require to optimize healthcare, we would love to talk to you. Thank you.